Good morning, good afternoon, everybody. We'll start and we'll let people in during the webinar. So this is the 8th Quality and Safety Network webinar. We'll be addressing a new topic this time that will be introduced very later. So the objectives of those webinars we've been organizing since 2019 are really to share best practices and experiences across Europe. Just one of the effective ways that we found that is to improve our health systems and more particularly quality of care and patient safety issues here in Europe. So we can learn from each other, share experiences, and maybe inspire ourselves to create new projects in our own countries or institutions. As I said, we've been doing those webinars since 2019. For those who didn't join or knew our initiatives before, you can see here all the topics we've covered already. All those webinars have been recorded and the presentations are also available. So if you're interested, you can just go on the YouTube channel and listen to the programs you'd like to listen to. So feel free to check this out. We'll be talking in the next few months in 2021 of the few topics here listed. So today we'll be having Margarida Eiras talking about the Portuguese patient safety culture assessment. And in October, we'll have the quality management system as a basis for patient safety in Estonia. And then we'll have a project that has been implemented today in Belgium, which is about patient-reported incident measures, which is a new topic from the OECD, who's trying to develop something more than just prems and proms. So if you're interested, you'll be able to register yourself for those webinars afterwards. So like I said, the next webinar is in 12th October, and you can already register if you're interested in the topic of quality management for patient safety in Estonia. Today, we're all from Europe today. You can see here a few countries highlighted in blue. Those are the countries that are represented today who joined for the call and the webinar. I'm not going to talk more. I will leave Margarida Eiras talk today about the Portuguese culture safety assessment. And Margarida Eiras is executive board member of the Portuguese Association for Hospital Development. Margarida, if you are okay with this, you can now share your screen and take the floor.
Hello, everybody. Good afternoon to almost all of you. We are already in the afternoon. I know that we have different time zones. So here in Portugal, it's only 2 o'clock. So I know that in most countries in Europe, it's a bit later. I am here with you today to share some findings that we have regarding the National Patient Safety Culture Assessment, which was performed either in hospitals and in primary care units, and also discuss some learning opportunities in order to improve patient safety culture in all healthcare organizations. As you all know, patient safety is recognized as a public health problem, and either the European Council, the Council of the European Union, and the WHO, they recommended patient safety culture assessment as the first step in order to implement safe environments in healthcare. So nowadays we know that almost all international organizations recognize patient safety as an issue, and assessing patient safety culture is very important as the first step. So considering these recommendations, Portugal has implementing a national strategy for quality in healthcare and also a national patient safety plan, which first objective was implementing the patient safety culture assessment. So we have been doing this for the last years. For that, we used two different surveys from the Agency for Healthcare Research and Quality. One is called the Hospital Survey on Patient Safety Culture that we translated and adapted to Portuguese. And also for primary care, we used the Medical Office Survey on Patient Safety Culture. To hospital settings, we have assessed patient safety culture in 2014, 2016, 2018, and last year. And for primary care settings, we have assessed in 2015, 17, and 19. And to ensure the implementation of these instruments, national assessments were conducted, as I said, and the Director General of Health took the responsibility for that with the APDH, the Portuguese Association for Hospital Development. So for the last 10 years or so, even more, we have been working a lot on patient safety culture assessment. The survey about hospitals, or this presentation, first of all, let me tell you that this presentation is divided into parts, one about hospitals and the other one about primary care. So we will start with the hospitals. The survey was a self-administered survey and includes 42 items. Many of you may know this hospital survey on patient safety culture, as it has been doing, and it has been used for quite a lot of countries and translated to quite a lot of languages as well. So it measures 12 dimensions of safety culture. And also it has another 2 questions that allow respondents to provide an overall grade on patient safety for their work area or unit, and to indicate the number of events reported over the last 12 months. So these are the 12 dimensions. We can see that they range from teamwork to management support for patient safety. So the way supervisors and managers see patient safety and promote patient safety actions and environments. Also, some dimensions on organizational learning and continuous improvement, and feedback and communication. As you all know, communication is a well-known problem at our organizations. So it's very important for patient safety, the communication openness and the frequency of events reported as well, and the non-punitive response to error. So these are the 12 dimensions that the survey, hospital survey on patient safety culture contains. Our results for the last years, as I told you, I can tell you that in 2014, we had 15 participating hospitals. So it involved 17,928 respondents, staff from those hospitals, which corresponds to a response rate of 18.3%. And we had 39 institutional reports sent to every institution and 1 national report. In 2016, we had a bit more of participating hospitals. We had 61 participating hospitals. and the respondents were higher as well, 18,938 staff members from the hospitals, which is a response rate of 18.5. We also had a national report, and 14 reports were sent to the institutions, to the organizations that took part in that assessment. In 2018, again, a bit more hospitals responded the survey. So we had 65 participant hospitals, which is 17,205 staff respondents, and a response rate a bit lower than 2 years before, which was of 14.9%. Here we had one national report, 18 institutional reports, and one technical report. Last year, as you all know, we were already with the COVID pandemic, but even so, we had a few hospitals that still wanted to participate. So in 2020, we had 38 participating hospitals only, and 7,360 participants, which was a response rate higher because we had less organizations. So the response rate was 24.1%. Again, we had a national report and 22 institutions. Primary care, now we are talking about primary care in Portugal. And again, the survey was a self-administered survey, and it has 52 items, 52 items. Again, 12 dimensions were assessed, and also with more 2 questions included, one to provide an overall grade on quality, and the other one to provide an overall grade on patient safety for their work area or unit. And these are the dimensions, a little bit different than the hospital ones. Some of them are quite similar, but there are a few different. For example, if you see here, dimension 2, patient care, tracking and follow-up, it's a different dimension. Staff training also, it's a new dimension. And owner, managing partner, leadership support for patient safety, it's also another dimension specific for patient safety. Office processes and standardization also, and work pressure and pace, and quality and patient safety. It's also another dimension. And here, as I told you, we had only 3 assessments, one in 2015, one in 2017, and one in 2019. And in 2015, we had 54 participating units, primary care units, with 4,596 respondents, 1 national report and 34 institutional reports, and the response rate was 20.1%. In 2017, we had less 2 units, so we had 52 participating primary care units, 5,299 respondents, and a response rate of 32.2%. And again, 1 national report and 42 institutional reports. And for the last period of time that we assessed patient safety in primary care units, we had 60 primary care units participating, which corresponds to 9,461 respondents, a response rate of 34.1%, and one national report, 40 institutional reports, and one technical report. So if you have a closer analysis of the reports published, as I told you, USA reports, and in Europe, Spain, Sweden, and Belgium, there aren't very disparities or great disparities when you compare the results at national level. Portugal really follows mainly the international trends. Regarding the dimensions with the highest average percent positive responses, teamwork within units is really the highest value in all analyzed countries, followed by supervisor and manager expectations and actions promoting patient safety. And non-punitive response to errors and handoffs and transitions are the dimensions with potential for improvement, as I told you already. To what concerns primary care units, a closer analysis of the reports already published in the USA, and here we only have reports from the USA. We didn't find European countries doing the patient safety culture assessment in primary care settings. So if you compare with USA, and it's important to notice that our health system is completely different than the American one, actually is the opposite of the American one. And to what concerns the health system, patient safety has an impact on patient safety, the health system. So, so when you compare primary care results, you can say teamwork represents the highest value in USA, followed by patient care tracking and follow-up, and work pressure and pace, and office processes and standardization, and owner managing partner leadership support for patient safety are the dimensions with potential for improvement. It is internationally recommended that patient safety is a public health priority and a critical component of healthcare quality, as you all know. Alongside this assumption, the development of a safety culture is essential to prevent errors and improve healthcare quality in general. Based on the analysis of the survey responses applied in hospitals and in primary care units in Portugal, it was possible to design a set of recommendations and proposals for priority improvement actions in order to comply with the National Patient Safety Plan, in spite of an overall response rate below expectations. Presently, it seems clear that the National Safety Culture Assessment is in a long term is essential to improve patient safety culture in hospitals and in primary care units. Not only for the potential to be able to perform internal and external benchmarking analysis, but also for the opportunity to contribute to safety culture improvement within each hospital and guarantee the implementation of robust processes on patient safety and quality levels. Patient safety culture is not yet widely considered as a priority by staff and healthcare organizations, and there is still a fragile level of notification culture in most of the Portuguese healthcare organizations. Hospitals and primary care units are beginning to be motivated to undertake safety culture assessments to accomplish either regulatory directives or monitor safety culture within the actual organization. Thank you very much. I'm here to open the discussion. So if you have any comments or questions, just feel free to do so.
Thank you, Margarida. I have a few questions to start with, and then if any participants would like to have any comments or questions, you can feel free to pop them in the chat. We'll be checking this, or just take the floor and ask your questions live. One question for you. There's a variation in the hospital participation rates. Is it because it's voluntary based assessment, or is it because of a restructuration in the Portugal healthcare system where hospitals are merged into one? How do you explain this variation?
Actually, we have hospitals from the health system are public hospitals are obliged to do the patient safety culture assessment, but we opened it either to the islands, so Azores and Madeira, and we opened it also to private hospitals. So I can say that public hospitals are continuing doing their patient safety culture assessment, and nowadays we have a few more hospitals from the private sector and from the islands, Madeira and Azores. That's why you notice there is a difference over the years.
Thank you. Second question. There's nothing about the future, but will you continue measuring the safety culture in Portugal, and will it always be every 2 years in hospital sector and primary care? Will you extend?
I'm going to start from the last part of your question. The Director of Health decided to do the assessment every 2 years because either hospitals and primary care units are motivated to enhance their patient safety culture. So they would measure this year, and they could use those results, those data, to introduce new projects and to introduce, the quality cycle. So that was the reason why they did it every 2 years and not every year. And at the moment, our national patient safety plan has been rewritten because it was from 2015 to 2020. So this year we will have a new plan, or at least an update of the last plan. So we don't know yet. We hope so, and people from the hospitals and from primary care settings, they are very interested on that tool, because this is a free tool that the Director of Health gives to the managers and to the hospitals. So people are really interested, but we don't really know yet.
Because I made the link with accreditation. You have accreditation systems already also in Portugal, where it's a requirement to have those assessments.
Yeah,
that's why I was.
That's why people are really interested on it, because it's quite easy to them to have that report, and easy to draw some some projects to get patient safety and even quality better next year and next year. So it's a very easy tool to use.
Okay, and my third question, maybe a little adapted. Considering if you're going to or not reorganize those assessments, I saw, so for the primary care questionnaire, you have integrated the 6 dimensions of the definition of quality. Would it have an interesting part to ask those questions also to the hospital sector, or isn't it something to be considered in this sector?
You see that we used the surveys from the Agency for Healthcare Research and Quality, and the hospital survey on patient safety culture doesn't have those dimensions. So we didn't include them. we actually used the survey itself. We didn't make any changes, either to the hospital survey on patient safety culture or the primary care hospital survey. We didn't do any changes. We used the surveys as the Agency for Healthcare Research and Quality did, so that we can compare our results, you know. That's why, but that could be an idea. Yes, we can try.
Maybe a fourth question, because I know the RTQ has a lot of versions of those quality, safety measurements.
Mm-hmm.
Do you plan to do it in other sectors? I propose, for instance, the long-term care.
Yes, we started already, but really we didn't have enough time to do so. It's very important because long-term care in Portugal and worldwide, it's a very important level of care. And nowadays is becoming every day more important. So we started already, but well, I don't have results.
No, of course. But it's interesting to see that, as your conclusion says, that a patient safety culture assessment is needed on the long term, just to evaluate and to be able to identify improvement projects. Yes. At the level of an institution, or even at country level, what a government can do. So it's really an opportunity to do those assessments in all sectors that are present in a healthcare system.
I suppose it's quite important for managers mainly, so that they can, it helps them for decision making. Of course. So it's a tool that allows them to act and to try to decide in the best way. So I suppose it could be a good tool for them.
I don't see any other questions in the chat. Does anybody wants to ask a question? I'll leave a few seconds. Meanwhile, I launch a short evaluation of this webinar, so feel free to respond to the little question that pops up on your screen right now. So we'll be able to see if you were satisfied with this webinar, which it seems to be. In any case, I would like to thank you, Margarida, for taking the time.
You're welcome.
The Portuguese results. So the results, there's an applause coming up. So thank you. For the participants, the recording will be available, just a slide adapted because results can't be published. And the presentation in adapted form will also be available for you. So as usual, you'll be receiving the link to both video and presentation within a week. So you'll be able to check again or use the presentation to start new projects in your country.
I would like to thank everybody for being here and sharing this time with us. So stay safe.
Yes, I see there's a thank you from Finland and another thank you. It was very useful. So, you know, everybody's been listening to your presentation. On this note, I would thank everybody for connecting today, and I'll wish you a very nice afternoon, and I'll see you at the next webinar that is scheduled on the 12th of October about the quality management system for patient safety in Estonian hospitals. Thank you, everybody, and have a nice day. Bye.